Deception.
The first time that an alleged hantavirus was, quote, isolated was said to be in 1978. The paper appeared in the Journal of Infectious Diseases and was titled Isolation of the Etiologic Agent of Korean Hemorrhagic Fever. It states, epidemic hemorrhagic fever was recognized for the first time in Korea in 1951 among soldiers of the United Nations. The paper then reports that an antigen detected in mice lungs in 1976 reacted with blood samples from patients with hemorrhagic fever. Now comes the bold claim that we present here the first evidence that this antigen is produced by a replicating microbe. Antigen is produced by a replicating microbe. Antigen is produced by a plasma extract for, quote, attempts at viral isolation. Next, they state that all experimental and diagnostic work was done with lung tissue originating from 4 naturally infected field mice. Note that this employs a begging the question fallacy in that they have already inferred that an infectious agent exists and is responsible for the purported disease. In the conclusion to the 1978 paper, it states, these observations, although definitely preliminary, provide substantial evidence that the etiologic agent of KHF has been isolated from the wild rodent. This is exemplary of the virologist's massacre of scientific terms. They are claiming that mixing ground up rat organs with cow's blood qualifies as the isolation of something. In their conclusion, they refer to it as an agent and a pathogen. Predictably, over time, this has become a virus. For example, Wikipedia states in 1978, the virus was isolated for the first time and named Hantavirus after the river. They did not find a virus in 1978, and neither has anyone else since then. What has been built up with regard to first antibodies and subsequently genetic sequences and proteins relies on this foundational fraud. It is the same story we have seen with all alleged viruses. No virus is ever discovered and then studied. Instead, they are fallaciously declared to exist in advance, and all findings are made to fit the imaginary model.
It's all a trick.
If you even look deeper into the name, Hanta means nonsense or lie. In Hebrew, it means a lie, a scam, a ruse, nonsense.
WHO just finished another global outbreak simulation, and then 1 week later, you got an outbreak on a cruise ship, and now suddenly we're flooded with stories about cruise ship deaths, quarantines, workers in protective gear, and warnings about possible human-to-human spread.
It's clear this is 100% scripted theater. A psychological operation designed to terrorize the weak-minded into surrendering their liberty all over again.
Let's not let it happen again.
Nobody has been genuinely infected in this hantavirus outbreak, at least not in the way the media wants you to believe.
In just a few days, over 100,000 articles were published globally about hantavirus. Think about the coordination that is required for that. This isn't organic news. It's a saturation campaign.
So here they are all dressed in hazmat suits. But guess what? There's going to be a guy without a hazmat suit just going to walk right up into him. Let's watch. So they're look, it's super scary. Oh, here comes a guy. No hazmat suit, no nothing. Not even a gas mask, no nothing. There's another guy. There's another guy there. He's just wearing regular clothes.
Right?
Isn't that, it's kind of amazing. He doesn't even have gloves on. So there's two guys just kind of stumble into this. Meanwhile, everybody else is dressed like they're on the moon. They're doing it again because you didn't hang them last time.
The virus doesn't spread from person to person. That's a false claim, and that's been cleared up. There's a paper by Toledo and colleagues in the Journal of the Infectious Diseases Society of America that has essentially disproven any person-to-person spread. It's spread from dust in the air that gets contaminated by rodents. That's how it spreads. Remember, Gene Hackman's wife, Betsy Arakawa, she died that way. And Gene Hackman later on dies. He has dementia. This is in Santa Fe. You know, when they went to Hackman's house, they found rodent droppings and mice and rats everywhere. That's what's the source of the infection.
CDC reported cases of hantavirus. Listen to this. As of the end of 2023, 890 cases of hantavirus disease were reported in the United States since surveillance began in 1993. All right, so let's do some quick math here. That's 30 years of surveillance, 890 cases. That's about 30 cases a year on average. If you do that, the CDC says 35% of those have a mortality rate of 35%. So you do that math, it's about 10 people per year on average.
You're 7 times more likely to be struck by lightning than to get the hantavirus.
It goes even deeper. Let's talk about the Select Agent and Toxins list. This is a list of 63 toxins and microorganisms that the US government considers severe threats, essentially lists of biological warfare agents such as SARS, monkeypox, and bird flu. And this means that the government knows that these can be engineered for added violence. And rather surprisingly, hantavirus is not on that list.
They knew about the hantavirus because they created it a long time ago.
Yet the US military has actually been experimenting with it for 40 years.
A July study published in Pathogens and funded by the Defense Threat Reduction Agency, DTRA, describes experiments in which scientists deliberately aerosolized sin nombre virus, a hantavirus with an estimated 30% fatality rate, to study how long the virus remains infectious in air under varying environmental conditions. The work conducted at the University of Nebraska Medical Center, UNMC, using a biological aerosol reaction chamber, BioArc, has sparked alarm because aerosolization is a core step in converting a pathogen into a respiratory hazard, and because the research was financed by a Pentagon agency.
The entire plot was already quietly set up in a 1998 movie, Fight the Future. It's worth remembering that the CIA used to feed script ideas to X-Files writers.
Are you familiar with the hantavirus as your mother?
Yeah, it was a deadly virus spread by field mice in the southwestern United States several years ago.
According to the newspaper, FEMA was called out to manage an outbreak of the hantavirus. Are you familiar with what the Federal Emergency Management Agency's real power is? FEMA allows the White House to suspend constitutional government upon declaration of a national emergency. Think about that. What is an agency with such broad sweeping power doing managing a small viral outbreak in suburban Texas?
You're saying it wasn't such a small outbreak?
No. I'm saying it wasn't the hantavirus.
Well, what was it? What was it?
When we were young men in the military, your father and I were recruited for a project. They told us it was biological warfare, a virus.
But here's what they never want people to understand. None of it works without public compliance. The entire agenda depends on fear, deception, and obedience, while the machinery is built behind closed doors. In Australia, over 300 deadly virus samples, including 2 full hantavirus samples, were reported missing from a government lab in 2021.
The freezer broke in 2021 and the materials transferred, but a gap in the paperwork means no one knows where they went.
It is a significant breach of protocol, but I do not believe there is a risk to the public.
2026, here we are. A convenient narrative, isn't it?
Our online conversations have intensified these past weeks after users resurfaced a 2022 post by the X account that referenced 2023, Corona ended, 2026, hantavirus breaks out.
It's possible that they, quote, predicted a bunch of things like this and then deleted everything else when it just so happened that hantavirus popped up in 2026.
It also is possible that Fauci, Gates, or any of these clowns, the World Health Organization put that tweet out.
It's possible that this is the person that is already working on the vaccine.
Right. I mean, that's the problem with this. If they come with a with a vaccine on this thing, I'm not taking the vaccine. I'm not taking it. And you know what they'll do? They'll lock you up if you haven't taken the vaccine. They'll do exactly the same thing they did last time. And then, our kids won't go to school and we'll have masks.
If you somehow believe that those who have an ideology for population reduction, that is the depopulation of the world, and we're talking, they want to do it by the billions, and they are not hiding it. We're not suspecting they want to do it. They said so in their own words, in their own speeches. They said so, and they have given reasons why it must happen, why it must be done. They have said that reduction of the world's population with huge numbers by the billions is the only solution to the world's problems. Haven't you listened to them? These are the people producing for you a vaccine, and you really believe they want to save your life.
According to the Gates Foundation whistleblower, global elites have been quietly spreading hantavirus outbreaks while finalizing the vaccines they plan to mandate on terrified populations. They got the patent out of the way just last year. Impeccable timing as always. Once they had a vaccine in place, they had to create a lethal virus. Bill Gates, his globalist vaccine cartel Gavi, and DARPA have been working on developing more lethal strains of the virus. No wonder Bill Gates' Gavi knew that the next pandemic was going to be the hantavirus.
They have a hantavirus pulmonary infection that they talked about as one of the results of COVID. It's in the 2021 document.
Hantavirus is listed in Pfizer's 38-page document. On page 33, it appears among 1,233 reported side effects. These are not accidents. They are the narrative control tools.
You can already feel the same psychological atmosphere building again. The media keeps hammering people with stories about long incubation periods and asymptomatic spread, which instantly creates paranoia because once people believe someone could be carrying something without knowing it, everybody starts to look at each other differently. Airports, crowded places, public transit. People already remember how fast society changed last time. People went completely berserk overnight. People acted like they didn't have brains at all. I know you guys remember these videos right here, okay? Total zombies. While the same public health figures from the COVID years suddenly reappear all over television acting like trusted authorities. What makes people uneasy is that none of the infrastructure built during COVID ever disappeared. The system stayed in place for this exact reason. The media playbook stayed in place too, the exact same script.
Another trick the WHO wants us to believe is pre-symptomatic transmission.
We know that it generally spreads through close contact. We don't know how much it might spread when people, just before people develop symptoms. It might be just on the cusp, or when they're symptomatic. And so because of all of that, we need to apply some precautionary principles and make sure that on the chance that people may pass the disease on even just before they become symptomatic, that they are in a context where they wouldn't pass it to others.
So if you don't have symptoms of hantavirus, they are claiming that that might be a symptom of hantavirus. Literally, this is what they're saying.
Remember, they said asymptomatic during COVID. They also say that during the very same hantavirus, now they are on pre-symptomatic transmission, despite them never conducting a controlled human infection model of the hantavirus. So this is a desperate attempt to once again push everything towards fraudulent PCR to fabricate a spread of the non-existent virus. As is the same with every other set of PCR test reagent, hantavirus PCR test kits comes with a legal disclaimer they are not for diagnostic or therapeutic use. Why are they using it? It works for their agenda.
A passenger of the MV Hondius cruise ship was described in reports as testing weekly positive before being transferred into a Nebraska biocontainment unit. Weekly positive. The exact kind of wording people heard nonstop during COVID when borderline PCR results started getting treated like confirmed catastrophe cases. The article never even explains what kind of testing was used, what the amplification thresholds were, or how they determined these positives in the first place. None of that nuance makes headlines because all the public is supposed to hear is positive case, critical condition, quarantine, and human-to-human transmission. The Department of Health posted this right here. 17 American citizens were airlifted from the cruise ship to the States. 2 were put in the biocontainment unit because one passenger had mild symptoms and another tested mildly positive on a PCR for the Andes virus. Look at what Eric Feigl-Ding, an American public health scientist, wrote. There is no such thing. Whoever wrote this HHS tweet just proved they are an idiotic imbecile, trying to minimize a newly discovered positive American hantavirus case aboard a flight to the US while trying to bullshit with mild PCR positive nonsense. The COVID propagandists are back.
The PCR tests, it's a fraud. That's what I told you.
The measurement for it is not exact at all. It's not as good as our measurement for things like apples. An apple is an apple. You know, you can get something that's kind of like, if you got enough things that look kind of like an apple and you stick them all together, you might think it is an apple. But and HIV is like that. Those tests are all based on things that are invisible, and the results are inferred in a sense. PCR is separate from that. It's just a process that's used to make a whole lot of something out of something. That's what
Also,
it is. But it's not. It doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything like that.
That's one of the reasons the numbers during the pandemic exploded into pure hysteria. I mean, they were all fake, but the PCR turned it all the way up. That's why mangoes and papayas and even river water was testing positive for SARS-CoV-2 a few years back. That's why mangoes and papayas and even river water was testing positive for SARS-CoV-2 a few years back.
That it was not made to test for those things and determine that someone has a disease. That's what he said. And that it can be manipulated to get what you want. Only God knows what killed him in August of 2019, just ahead of when the PCR test kits were sent out to different countries, ahead of the COVID-19 bursting forth in 2020.
The testing itself became part of the engine driving the fear. These genetic fragments were never proven to be part of any virus. Why? Because no virus has ever been fully isolated and sequenced by itself, ever.
So, all this nonsense, we will not be deceived again, right? It's all hogwash. Nonsense. Nonsense, absolute nonsense. They're not going anywhere with it. Their agenda is dead. It's dead.
Behold, I send you forth as sheep in the midst of wolves. Be ye therefore wise as serpents, and harmless as doves. Matthew 10, verse 16.
Praise God.